Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina. My practice is Hickory Spine, and today I want to talk to you about some things that you may want to consider to help you improve a whiplash injury at home. Okay, so some of the things that I've seen people do that can be beneficial and that we often recommend is to do very simple things like using heat and ice. Now, if it's within the first day or two, typically you want to use ice to try and help calm down the inflammation and the sensitivity that's occurring. Especially the inflammation encourages increased nerve sensitivity and can cause more pain. But one of the things that you can do is like initially use ice. Beyond that, sometimes you can transition into using heat. One of the benefits of heat is that it brings more blood to the area, it improves circulation, it relaxes the muscles, it helps to bring more nutrients and oxygen to the tissues so that they can heal faster. Now, you can typically do that after the first few days. When you're in the inflammatory phase of healing, which is typically when there's swelling, heat can often make it worse because it brings more fluid to the area and it can cause congestion of the tissues, swelling, and ultimately cause more pain. So, heat and ice are fantastic ways. Usually using heat early on is the most beneficial. Using ice early on is most beneficial. Heat after the first few days is helpful. Now, you can also do what we call a contrast, where you use heat and ice alternating. And what you do there is you use an ice pack wrapped in a towel. You don't place any ice or ice packs directly on the skin because it can burn you. Same thing with a heating pad. You don't place a heating pad that's really hot directly on the skin. You wrap it in a towel. You've got to make sure that you're not going to burn yourself or freeze your skin by placing something that's really hot or really cold on there. But what you can do is you can do an alternating. I like to most of the time I like to end on ice, but you go heat. You can start with a heating pad for maybe 10 minutes. Then you can use an ice pack for about 10 minutes, then a heating pad, then an ice pack. And that alternating of the heat and ice helps to flush out inflammatory chemistry from the tissues in that area, and it can really help to accelerate healing and give you a lot of benefit. That's probably the easiest thing that you can do for a whiplash injury at home. I do highly recommend and suggest, though, that you get a proper workup and diagnosis before you start self-treating, because one of the things that we commonly see occur is that people have torn spinal ligaments. And that when you have a whiplash injury, that's what you have. You have torn ligaments. The question is, to what degree are those ligaments ripped or torn? We take specialized x-rays and we use computerized radiographic measurements. So we use a specialized software that helps us to measure the position of the bones of the spine. And with the software we use is actually what is used in university research on spinal mechanics, how the spine actually moves, what's the position, what's the integrity of the ligaments. We use the same kind of software, and it compares your spinal position to that of the normal person, and it tells us what's wrong. So it's really very, very helpful at helping us to understand what type of severity of injury that you have. But I hope this helps you to better understand some things you can do to relieve whiplash injury pain at home. Remember, first and foremost, get a good diagnosis so you know what's going on, so you can get the appropriate help that you need. If there's anything that we can do for you, please don't hesitate to reach out to us. Our phone number is 828-324-0800, and you can also find us at hickoryspine.com if you'd like to learn a little bit more about what we do. But I hope this has been helpful, and I hope you have a wonderful day. Thank you.